Hi, everyone, and welcome to Webinar Wednesday. We're glad to have you with us for today's presentation featuring Aaron Peters, Product Manager of ames 3, as he provides methods to easily organize and manage teams that have custom workflows with greater visibility. Webinar Wednesday would like to thank our sponsor, Phoenix Data Systems. Phoenix is committed to offering the finest software, service, and support available in the industry. Their software has evolved by listening to and collaborating with their customers. Their 37th annual ames User Group Conference is just one of the primary ways they achieve this exchange of ideas as they continue to uphold their commitment to the continued development of ames 3. For more information, please visit goames.com. A few announcements before we get started. Don't miss our 20th anniversary celebration at MD Expo in Atlanta next month, April 11th through the 13th. MD Expo strives to provide healthcare technology management professionals with a unique, intimate, and rewarding conference second to none. You can find all the details and free registration at mdexposhow.com. Let's give one lucky attendee the opportunity to win a Webinar Wednesday shirt by answering the following question. In what year was Phoenix Data Systems founded? You can find the answer by visiting our sponsor's website. Please use the questions feature in the GoToWebinar dashboard to submit your answer. As I mentioned earlier, our speaker today is Aaron Peters. Aaron, you may begin whenever you are ready.
All right, thank you very much. Well, we are very excited to show you guys how we can help manage teams in ames 3. First thing to understand is that there are two different types of teams. So we have technician teams that fall within what we call a service department. It's kind of an ames term. It's your clinical engineering, facilities engineering, radiology, those kind of departments. So you have teams within each one of those, and then of course the entire department itself is also a team. So we have ways of helping to manage both. They work together, they work differently, and I'm going to walk you through all of that today. So looking at the agenda for today, we're going to first talk about your technician teams, those teams within a department, how we create those and manage them and swap team members out, what that looks like for a manager view and how it works at the tech level, and then also how we can help with work order assignments for teams as well. We will move on and talk about those whole department settings there with assignment profiles, different risk setups, and even how interfaces can play into your different service departments. And then lastly, some other benefits that can take advantage of helping manage teams are our automation tool, critical messages. We have both off-the-shelf and custom critical messages, and even customer service forms. So that's what we're gonna look at today. If there are any questions, just ask them and we'll answer them towards the end there. So let me get the system up. And we will jump right into the software here. So a few things about team management in ames. We've really tried to make it very, very simple to both create a team and manage the employees in the team. So you're not going all over the software trying to set it up different ways. So to start with, how we create a team over here in our data managers. Data managers, again, kind of an ames term here. It's all your drop-down lists throughout the entire software are set up here. So you can see our employees are set up here, and this is also where you set up the teams. So to create a team, you simply come in here and hit new, you name the team, and you choose the team members, and that's it. We honestly keep it that simple on purpose. It doesn't need to be any more complicated than that, because the contact information for each of your employees is all set up at the employee level already. So there's no need to do duplicate work and create it over here as well. So to create a team, you simply do that. To swap team members out, you're just in here checking and unchecking boxes. And it's kind of that simple to change your team members in and out. That's one way of taking care of your teams. The way this works at the manager level is it doesn't have to. So when you have an employee in here that is a manager, which is just a simple checkbox, you can assign that team to the manager. You don't have to assign each individual employee. That way, as team members leave, which we know they do constantly, you're not in here trying to remember what you need to change and you have to change the manager. You just swap that team member out at the team level. And if that team is assigned to a manager, you're done. You don't have to touch the manager. You don't have to touch work order assignments. We'll get into this a little bit later. But you literally just swap them out at the team level and nothing else needs to happen for the rest of the software to work and for the new team member to view all the work orders and have all the same functionality as the existing team members. So you can swap team members literally in seconds. At the work order level, kind of the same thing. You assign the team to the work order. You can assign individual employees. This is all multi-select in here. So you can have an individual employee along with a team, or you can simply assign the team itself. You can even assign multiple teams. So if it is a larger project on the facility side, if it's a construction project, or even on the biomed side, anything where teams need to work together to accomplish something, you can assign multiple teams here, and everyone still has visibility to who is assigned to this. I may not know who's in my defibrillators or my electricians, but if I simply click the team members button, it's going to let me view everyone who's a part of that team that's assigned to this work order. So I get instant visibility to who's assigned, even though it's a team. This button is everywhere in the software. So you can assign teams to the equipment level, to the PM schedules, directly on the work order. Pretty much at any level, you can assign a team and always have full visibility as to who is assigned to it. Now, there's many of you, I assume, use some version of auto assigning. So when a work order is created, it's automatically going to be assigned to someone. If you don't work that way, which many places still don't, you can actually still take advantage of teams. So you can assign a team of people. So it's not just floating out there assigned to nobody, but it's assigned to a whole team, and then an individual from that team can grab it as well. The way that's done in our software is over here in System Setup, something called area assignments. So you can come out here to an area assignment, and you can assign it directly to an individual. So if I look at Barry here, Barry has some things assigned to him. So anything that comes into this cost center or this equipment type or this what we call job type will automatically be assigned to Barry. You can do the exact same thing to a team. So if you have a team in here, anything that comes in, all of my defibrillator equipment types are automatically going to get assigned to this team of employees. Now, what good does it do to have a team on there? What advantages does the tech have? What advantages does the manager have? So it's very easy, obviously, to create the team, get them assigned on a work order automatically or manually. That I've shown you in seconds here. But what are the advantages of it? So the way that our system works is we have this nice user-defined home screen. Can be custom per user, can be static if you want it to be. But the advantages all happen here. Most of them happen here. So if I am a technician and I'm part of a team, any work order that the team is assigned to is going to show up in my employee work order log. This is not every work order in the system. These are ones that are in my domain, my realm. So whether I'm directly assigned or my team is assigned, it shows up here. All of these charts on here pretty much work around that concept. So everything you're seeing here, overdue work orders. I know that our team, now again, this is demo data, but I know that our team has 108 overdue correctives. Hope your team's a little better than that, but if they're not, you have a chart here that knows that information. These charts are also interactive. So I can see that as a team, we have 8 urgent work orders. If I click on that, it filters my home screen chart. So now my team, during our morning stand-up that we do, we can go through and say, all right, let's get these taken care of, and we can jump right in and take care of these 8 urgent work orders. So these screens and charts kind of all work together. Now, as a manager, who I'm logged in right now, you get a little bit different view. And that comes in the form of mainly this chart here. Now, obviously, I can see different assigned tos in here because I'm a manager. These are my employees that are assigned to me or my team that's assigned to me. It also breaks out this PM completion chart for my different employees that work for me. So I can see that we're kind of just over 50% of the way through the month, and no one's really keeping up with their PMs for the month. So this allows me then to go have some meetings, make sure that people are up to date on these. If, as a manager, I wanted to drill down and just look at one employee, I can do that as well. So you have filters up here. I can see how this person's doing in one particular hospital, or if they work in multiple. You still get all the other benefits. You can still click and drill down. You can still click on any one of these work orders and jump straight to it. So that's going to let me reassign it if I have to. I can raise the priority. I can page it back out to that employee and say, you need to work on this. It allows me instant access to both the macro level of here's where everything stands from a high standpoint, but then I can instantly drill down to a single work order and make sure that it's being taken care of properly. So these are all kind of off-the-shelf offerings as to how you can view it, what it looks like for the manager and the tech on the home screen here. It's a really easy way to assign multiple people all at once and manage it in seconds just by creating that team. Now, some other advantages of this are reassignment. So if I do need to reassign something, I can do that as well, either to a team or from a team. If I have a team assigned, I'm the team leader, and I want to now break it apart, we have tools that help with that also. So over here in our list view section, I've filtered down to a single employee. This could be a team, this could be any sort of filter that you want. But right from in what we call list view, just kind of an on-screen Excel, right from this screen, if I hit my update, I can now reassign these to anyone I want. So here's my 41 work orders. I can grab a selection of these, any selection I want, or I can select all, and then I can now reassign them to someone else, either to or from a team. So these kind of global tools we have here are a way to just very quickly update and assign things out as needed. So they don't have to stay assigned to the team. I can split them apart as the team lead or the manager and get individual people to work on them, if that's the way that you function. So these kind of global tools make it easier to manage as well. And of course, a team member can always just come in here and assign it to themselves as well if they have security rights to do so. So obviously, very easy to create teams, to assign them. The advantages are you don't have to multi-select every time and pick different people to assign to it. And then whether or not the team works as a team or it's just kind of a placeholder for a group of people to handle it, it's kind of up to your workflows. We obviously will function either way. So if you do reassign them from the team to individual members, we have bulk tools for that. If it needs to be performed by the team, of course, it'll show up on every single person's home screen chart. So every single person of that team is going to see the same work order. And then they can go and perform their role as a part of it, or jump right to it and reassign it to themselves, as you saw me do earlier. So if I wanted to reassign this to myself, I can do that very quickly right from the screen as well. So very easy to set up, very easy to use. Advantages just come with increased visibility. Everyone can kind of see the work order, see what's going on. The manager can still manage it from a global level and reassign it as needed very, very easily. So that's kind of the technician team side of it. Now we want to talk about the service department side. And again, service department is pretty much an AMES term, but the list would be clinical facilities, radiology, IT, security, housekeeping, all departments that use AMES in a hospital. It could all show up in this list if that's the way that your database is set up. So what advantages is there of having a database with all of those departments combined? There's obviously very easy benefits to clinical and radiology. There's a lot of overlap there. In a lot of cases, you may even have techs that work on both. Facilities is where it gets a little interesting because there's basically no overlap between those, unless, of course, there was some sort of joint project that needed both teams involved. New construction is a good one. A lot of you, I'm sure, during early COVID, when you were creating new ICUs, that's going to take facilities and biomed teams working on the same project, not necessarily concurrently, but dealing with pressures and all of those things that both teams have to deal with. So there's a lot of reasons and benefits of having those departments in one database, along with then, of course, joint reporting. So if you have every department in your hospital in a single system, now you can get global costing and you can share resources and do things as needed. So the benefits are there, but how easy is it to manage? What we've done in AIMS 3 is we have a concept called assignment profiles. Now, assignment profiles, you can break these up any way that you see fit. You literally could do this at the same team level I just showed you if you wanted to. This is probably more likely going to be done at a macro level, however. So you would have biomed, maybe a joint tech in there, a facilities tech. But I did want to show you that you could split out trades. So if you did want to split plumbing into their own assignment profile, you certainly could do that. You had different levels of biomed techs. You could split those out as well, where maybe your biomed level 1s can work on one range of equipment types. Your biomed level 2s have additional training, and they can work on additional equipment types, for instance. And that is the power of assignment profiles. Anything that you see here, and we're constantly adding to this, there's 2 more that should be in the next couple weeks, but anything that you see here can be filtered for that assignment profile. Filtered does not just mean that they can't see the equipment and work orders. We had that in ames.net. You could set a filter and assignments, and it would restrict the records that the users had access to. But the advantage here is this restricts the dropdowns. So if I were to log in as a facilities tech, they're not going to see all of my 1,500 equipment types that are in my biomed department, because there's no reason for that. They're going to see the 6 in this case that I've let this group of techs see. So this does 2 things. It limits the records and it limits the dropdowns. And I'll show you this in a minute here. We're going to log in as a facilities tech. So that's one way of doing it. Now trade can come into play here as well. So trade is just specialty. That's all it is. And again, this is mostly used on the facility side. I've seen some biomed teams use it successfully, but on the facility side, of course, they have HVAC, plumbers, electricians, painters. They have all these different groups of people, and they tend to use this field very, very heavily. If you find a use for it as well, you certainly can pull it in here, and it's just one more limit of what you can see. So as you start to use the system and you start filling out this trade field, it's just another limit of ways of saying, okay, instead of seeing all clinical engineering, they're going to see this subset of clinical engineering. So it's just one more breakdown of the service department, essentially. Now, these don't work independently. You can use teams within a service department. And that's probably the most likely way you're going to do it, as a matter of fact. But you still get the team benefits even if you have multiple service departments, and even if you have a manager or a director over multiple service departments, you can still have those separate teams. So that work order I showed you actually had a biomed and a facilities team on it. So I had my defibrillators and my electricians on there, and even though they're different service department, completely different groups of techs, they'll have their own home screens, their own managers, everything. I still from here can see everybody. So I can see who's part of each team and who's going to handle which pieces of it. So teams and assignment profiles very much work together. It's not one or the other. You can use one inside of the other. You can use each independently. You're just a clinical engineering shop and you don't really have a need for assignment profiles, you don't have to use them. You can still use teams and vice versa. The other thing that's really, really important for your different service departments is risk. Anyone who's been around a while, clinical engineering risk, facilities management risk, 2 very, very different things. They're not really compatible in any capacity. So what we've done here is you can now have these different risk types out here. As many as you want. You can have general medical equipment, you can have high risk, you can have life support, infection control. You can have some that apply to facilities, some that apply to clinical engineering, and some that apply to both. So this should obviously look very familiar to you guys, where you have your risk 1 plus 2 plus the average of 3 through 5. That's fairly standard. Some people have moved on from that, but this still rules the day in conversions that I've seen. So you have your fields here. Facilities can have their own set of fields, may look something like this. I've seen much more variability in facilities risk than in clinical engineering risk. And then of course you can have high risk with its own set of values as well. So there's no limit to the number of these you can have in. And then after they exist, which would likely happen in a conversion, you'll get your values in here again. This is standard things I'm sure most of you have seen before. So once all these come in, then over at the service department level, which is our main split we're talking about here, you can limit what risks each one sees. So my clinical engineering here, when I come over to risk type, I can determine which of those risks this group of technicians has access to. They won't even see the other ones. When they're on an equipment record or a work order and they're trying to look through risk, they're not even going to see this in the database. That's how separate we keep this. Same thing, if I'm a facilities tech, I'm only going to see my one list of facilities that I have. I'm not going to see the other ones. Now, how can you get away with just one set of risk? So the most common split that we've seen is you have your utilities equipment, you may have some general equipment, and then you'll have a life safety on the facility side. And then on the biomed side, we typically see something like general medical equipment, high risk, either life support or infection control or both. That's kind of the breakdown we've seen. We don't actually have to work that way anymore because we've taken risk one step further. And the one step further that we've taken it is something called classification. So this allows you to set up risk ranges. And in these risk ranges, you can determine what value is going to be visible on screen. So instead of just knowing that 17 equals high risk, the way that this software works now is once you have your risk filled out, whatever you fill out here is going to set your risk classification automatically. So you don't have to have all these different type options. We realize a lot of people work that way, and that's obviously why we added it, but you don't have to use it that way anymore with this new classification field. And if you're one of those people that have decided with all the changes that have happened, risk is actually less important now to fill out all those individual values for some customers, you don't have to fill out the risk. You can just pick from this dropdown. So it will take this whole step out. If you don't use this anymore, don't use it. Just come up here and choose your risk classification. So there's a lot of ways to use risk. You can use it completely differently in each service department, and each one is going to have a unique set of risks. That's very, very important to managing both systems. The last piece of this here is actually in interfaces. Not every department needs every interface. So AMES can interface with absolutely everything, whether it's a flat file exchange, an API, any web service calls, it really doesn't matter. We do punch outs. Part source, for instance, is a punch out. One source is a punch out. We can still pull data back and forth no matter the type of interface it is. So if it's something like a ServiceNow that uses APIs, we can pull and push, they can pull and push, data can flow freely between both systems. And it's every field in our system. A big change to AMES 3 came in the form of the API. Every read and write in our entire software uses our API. We use our own API to read and write to the database. Therefore, every field in the entire system is available to be pulled and pushed through an API. Documentation's built right in, so if anyone wants to see documentation, they can click there. And then, of course, how each interface works is mostly custom. Each person uses things a little bit differently. So how one of you uses ServiceNow or Sharewell or some other IT work order system is going to be very different from another customer of ours. So we can customize most interfaces. Something like a part source is more determined by them and their workflow. So those are a little more hard coded, but you can work with them and there's some flexibility there as well usually. So interfaces are different. Not everyone's going to need cybersecurity right now. I haven't seen a facilities team yet that wants it, but obviously a lot of biomed departments are interested in it. So we can break it up so that only certain people use certain interfaces and it's not trying to pull and push data that it really shouldn't. So every interface with that customization I talked about can use each interface differently. For instance, we have a customer who has a PeopleSoft interface. The clinical engineering team uses it for purchasing. The IT team, who also uses AMES, does not. They do use PeopleSoft, they use it for the HR side. So we actually interface twice to the same vendor, but two completely separate interfaces. So you really can customize your interfaces how you need and not pull and push all that extra data and slow systems down by doing unnecessary steps. So these absolutely come into play with trying to manage different teams as well. All right, now the fun part. So we have other things in the software that can help with not just the management side of the teams, but just in general workflows and things like that. So number one is, of course, automation. Anyone that's ever seen a demo, stopped by any of our booths or anything like that, automation we talk about constantly. So what I think is a little bit different about Ames than others who have some form of automation is this is the most user-friendly that I've seen. So it's all done through drop-downs, and you can add as many conditions, as many different action types as you want, but you have full control on the front end, no interaction with us. There's no cost to this. It's included with every Ames sale. You don't have to work with our programming team. You don't need your own programmers. An admin of the system can do this all by themselves. So it's very, very user-friendly. The last customer that we had go live, apart from the one that went live last week, by the end of their first week, they already had 3 notifications running, three automation rules. So very easy to set up, very, very powerful. For instance, just generically, a workflow of automation could be when an equipment status changes from anything to retired in any of my facilities, here's the steps that I want. I want to close out the open work orders. I want to notify the assigned employees to those that it's being retired. I can include a link directly to this record. So right from that email or text message, they can click or tap on that. It'll jump them inside of Ames and directly to the record that was retired. And then I can, of course, choose different fields I want included so they have any idea what I'm talking about without having to jump into the system. So that notification is automatically sent out. And then after closing all open work orders and notifying the techs, we're also going to open a brand new work order to retire the equipment, to clear the PHI, to scrap it, whatever your process is, you can put a procedure right on this work order. And then everything you see with the little blue pound sign hashtags, depending on your age, that will default from the parent record. So I don't have to fill this in. I don't have to create one of these for every different equipment type. It's going to pull it in off of the record. So it's going to pull the cost center, all the location information, everything that possibly can pull in from the equipment record or the work order, depending on the trigger, is going to pull in a default. So I don't have to fill out much, and I will get a work order that's assigned to the correct person, has all the tag and location information, so we know where it was at, has the procedure that we're going to perform to actually retire the equipment. Now, what's neat about this is you could actually customize this for different teams, different equipment types, whatever you want. You can simply add in more conditions. You can say if the service department is equal to facilities, do this. If it's equal to clinical engineering, do that. So you can split these rules and have different conditions in here that do different things. For instance, there are, of course, equipment types that can't store PHI. So to have tasks in that procedure that say clear the PHI and whatever your approved steps are won't always make sense. Of course, they could NA them, or you simply come in here and you add in an additional equipment type filter where you say if it's equal to one of my equipment types that can store PHI, then choose this procedure. You'd copy this rule and have a second one in here for if it's not equal to those same equipment types, it wouldn't have those steps in the second procedure that you would choose. So you can split this and do different things with it based on the team, the service department, any condition you want, really. So in general, it's that powerful, it's that easy to set up. Now, one of the things that we have a customer who has multiple service departments live, they have a rule in here that I've basically stolen from them. I've copied. If they change the service department, so something that happens when you have systems with multiple service department, facilities, clinical, etc., things are going to come into the wrong place. The person entering it is going to choose the wrong service department. The clinical staff member, when they're using the web request form, is going to accidentally choose the wrong one or click on the wrong link. It happens daily from what I've seen. So what they've set up is whenever I change the service department from one to the other, I'm going to send a notification out. Same thing, same screen you just saw. I'm going to send it to the admin, let's say. You could change it to whoever's assigned to the work order. You could change it to managers. There's a lot of different ways, different types of people you can contact. I just kind of happen to go into an admin email address. I just put a header in there called whatever I want. I include a link to the record, and then of course I choose fields, and there's no limit to the number of fields you can include in the email. So you can see there's a lot of different fields in here to choose from. So that's a simple one. They have that set up day one because this literally happens daily for them. So as soon as they switch that service department over, that's all you have to do. You don't have to notify anyone. You don't have to print anything. You just have to switch it. The notification through automation takes care of the rest. So if something comes into the wrong department, I've seen other systems where they have to call the other team and give them the information, or they have to go online and submit a second work order. You literally just switch the value in this one. It's as simple on a work order of going to the service department field and saying, this one's supposed to go to facilities. If I saved this and I had an automation rule set up, it would message the facilities department for me. That's how hard it is to switch work orders in this system to a different team. So automation, we love it, of course. It's extremely powerful. If you want to see it in action, which we won't get into too much today, we are going to be at the upcoming MD Expo. I believe it's booths 313 and 315. So feel free to stop by, and I can give you a run through of different scenarios that we've seen in production databases already. So stop by the booth, and I'll walk you through that. But automation is the talk of the town amongst our users. So that is definitely a tool you can take advantage of for any sort of team assignments, team management, notifications. Anything you can dream up can probably happen through automation. So that's the first one. The second one is something called critical messages. Now, if we look up here on this particular record, we can see some messages up top that are very important messages in our opinion. First of all, it's under contract. I can click on this and see my contract information. I can see it includes labor and travel. I know what the dates of coverage are. I know the provider. I have a phone number. If I was on a phone, I could tap on this and call them up. With security rights, I can click on this button and actually go view the contract. It's marked as a critical system. This is more of a custom to you. What is critical to you? So we just give you an option to set it. Your criteria, of course, is up to you and your team to figure out what critical means. A lot of times it means maybe it is critical, it's life-saving, and we have very few of them. It might be that it makes a lot of money for your hospital. I've seen a lot of different reasons to mark something as critical. That's an important message. It's down. This is a neat workflow. We unfortunately will not have time to look at today. But what we can do with equipment down is show you the work orders that it's marked down on. You can jump right to them and go fill them out. So in this case, the unit won't turn on. Well, it's probably down at that point. So this is a whole workflow in and of itself. But these are all critical messages, whether they are custom or built in. These are actually a combination, and you have control over these. So what you can do over here in System Setup is go to Custom Critical Messages. You can see I have a variety of ones set up here. So for instance, if I'm on a work order or an equipment record and the equipment record is retired, I get a message up top. You get to determine the color and the message and whether or not it's visible in EasyNet, which is our web request system. So my clinical staff, if they put a tag number on a work order they're going to submit, it's going to say right across the top it's retired. That should trigger them to go and make sure they entered the right tag number. If it's like most clinical staff, it may or may not work. We've seen very good success with some teams and very poor success with others of even getting them to enter a tag number. So that's more up to you and your relationship with your clinical staff than anything else. But you can determine whether or not each one of these is visible in EasyNet or not. So there's a variety of things you can do with this. They're not all applicable to today's discussion. You can see we have a lot of different things you can trigger on. Work order status, work order priority, risk classification, ownership. So these can be used to just provide additional information across the board. So if equipment's retired and it's being put on a work order, that's important for all teams, all departments, all everybody. And again, it might be that they entered the wrong one, or it might be that it's been lost for a long time. So if it's a bed or a wheelchair, especially, those things move around so much, they get marked as lost, they get marked as retired. This might be a trigger that says, hey, this is retired, it's the correct tag number, somebody found it. So now we can bring it back online, perform the inspection, and put it back in service. So these can really help with your workflows, kind of regardless of team, but there's ways of making them work within a team as well, something like an outside clinic. So anything that's put in that sort of building level, you can mark it as billable or not. So depending on whether that's a facilities or a biomed team may have different meanings, but it's good information that you can see right at the top of the record, so you know that you're going to bill for whatever it is you perform in there. So these are all the custom ones. The ones I was originally mentioning, the ones kind of across that top line earlier, if we jump back to that record, these are kind of hard-coded. There's a warranty one that literally matches this one, shows you roughly the same information for a warranty. And then down here is where you would see the custom messages. They're all in the same area, but you have control of color and some things on these ones here. So critical messages can help as well. And then the last main thing we're going to look at here is going to be customer service forms. So these, for the most part, are automatic emails. Everyone's seen these. You submit a work order or a form online or something, and you get a response that says, thanks for submitting it. When something's completed, you might get one back that says, it's been completed, call if there's additional problems, whatever it might be. So you can kind of customize what you want these to look and send out as. However, these need to be split by service department. For example, the majority use case of facilities work orders don't have tag numbers. On average, 90% or more do not have tag numbers. There's no reason typically to include that in an email that you're sending out automatically. You don't need that, you don't need the equipment type. You can save a lot of space and not be sending these blank fields for every work order essentially. So you want different forms, and the setup side of this allows you to determine which service department this gets sent out as. So I can say for a corrective maintenance work order that's opened, for my clinical engineering team, I want one form, not the completed form. I want the received form. For my facilities team, I probably want a different form. If it is generic, good for you. You can say all, so you don't have to set each one up individually. It's just less common. Certainly the completed form is going to be different because that's where you're going to put your extension or some phone number for follow-up information. And almost every hospital I've ever visited, different phone numbers, different departments. So you don't share a workspace typically. So this would allow you to have different forms for each of your different service departments. Now, to go along with the form, we highly recommend a survey. So what surveys allow you to do is see how your staff is doing. So these would typically, of course, only be sent out when a work order is closed. There's nothing to survey as it's first opened, unless you want to ask them how easy it was to submit it. But you can now have different surveys. So don't think of this just as one survey for clinical engineering and one for facilities. You can have one survey for different work order types. So if you performed a recall, if you performed any sort of project work order, you can actually have a different survey, a different form that's sent out, because when you pick that work order status there, you also can pick whether or not a survey is included, and you get to select the survey and put instructions for filling it out. So there's a lot of flexibility here to create forms for your different service departments, your different teams, include different surveys for them, even depending on the type of work if you wanted to get that granular with it. So you can really make sure that you are taking care of your customers, because at the end of the day, that's what you're trying to do. Your customers are the clinical staff. You're trying to keep their jobs running smoothly so they can take care of the patients. So you want to make sure that your staff is accomplishing that. This is the way to do that, is through these customer service forms and surveys. By the way, any of you that are Ames customers, if you've ever submitted a work order, if you called tech support, submitted an online request or anything, decent chance you've gotten one of these from us. We use this exact form, that exact survey, to track how we're taking care of our customers as well. So not just preaching this to say it, we literally use this function here to make sure that our support team is taking care of our customers. Same reason that we would want you to use it. Then, of course, the last thing before we open it up for Q&A is the reporting side. So we've already shown you kind of some of the charting availabilities. Of course, we can do anything with charts. So there's no limit to what can be charted. We have a full dashboard suite. This is a small sample. These are mostly built into the software here, but the dashboard application does the exact same things. So it's got the drill through, it has the, you click on one chart and filters another sort of thing. They have all of that. So all the charting capabilities, I think most people are aware of how all of that works now. What's neat about our software from the other reporting standpoint, first of all, my assumption is everybody has an export to Excel. So you can choose what fields you want to include, you can filter them. So obviously teams come into play here in as many ways as you want. So I can say a particular service department, I can filter that. I can filter it to a particular team or a trade in any of these fields. So I can filter this down and do an export however I want. That I think is fairly common functionality. Save that as a macro so you don't have to constantly go in here and do it. So if I want my open facilities work orders, I can have that. So, there's ways of managing this from a team level that are fairly self-explanatory, I feel. We have our list views. I showed those earlier here. So list views can be filtered a lot like an export because it's basically an on-screen export. So not a lot different there. As far as the filter is concerned, you would come out here and go to, again, any one of these things. So if I wanted to filter this by service department, I can do that very easily. So no difference really there between this and the other screen. The last thing is our actual reports. Now, what's neat about Ames, we have what we call pre-built reports. These ship with the software. There's a lot of them. We ship a lot of reports that have been asked for over the years. That being said, is it going to work for you perfectly? This was requested by a customer. We tried to make it generic and put it in here for everybody. Is it exactly what you want? Probably not, because you may want the status field instead of a location field, for instance, for whatever your reasoning might be. Well, what's neat about Ames 3 is every report, including the pre-builts, can be customized. We have a built-in report designer. You launch it right from within the software. You can edit any report. So I have that AEM report. You can kind of see it's sticking out right there. I can edit this. If I want to come in here, we don't use site ID. We're not working with vendors, whatever the case may be, and I want to put the equipment status in here. It's very easy to come out here, and I am by no means an expert at this, but it's very easy to come out here and switch the field around. So if I want status, I simply come in here and say status. I change the label to say status, and I've swapped that field out now. If you want to add in a barcode, you can add in a barcode. If you want to add in your logo instead of ours, you can swap that out. If you want to put charts in these reports, if you want to just create a dashboard, you don't need any information, you can just put charts on there. So custom report tool, again, ships with the software. Everyone gets it, it's included. You can make any changes you want. You can also just come out here and create a brand new report. So there's no limit to what you can do with this. If you're familiar with Crystal Reports or the old Ames Report Designer, or probably any other report designer, this will be pretty familiar to you, I feel. You can preview it. There's a lot you can do. What's really neat about this is you can connect to other data sources as well. So you're not just limited to the Ames database here. If you did want to report and pull in data out of another system, it even attaches to things like Excel. So there, you can really get creative with your reporting, I feel, with a tool like this. And that goes for every report in the system, even the ones that don't necessarily appear in this list. For instance, if we go back over, I'll go to this piece of equipment. We have a built-in report over here called Cost Summary. This report is going to show you a graphical representation of your costs and things like that. But this is also customizable through that same tool. So even though it looks built in, it looks hard coded because you launch it from the tools menu, it's not. You can still customize it. So it's very easy to get the reports you want, to filter them to a particular team, to a service department. The filters that appear on the side, even if it's not an option today, you can even customize the filter options on the side. So if it's not something you see today, like right now we have service department, easy. So if you want to filter to just one, you click on it. If you wanted additional filters, you can also add those in that report designer tool. So you have full control over these reports now. It's pretty amazing. These reports also, probably should have shown you from that screen right there. These reports can also be printed and downloaded to different things. So you can print it, you can download it to different formats if you want it in Excel, if you need a PDF or a CSV. You have a lot more options than you used to, certainly in our old software and in many others that I've seen as well. And lastly, contracts. So this is one that, interestingly enough, came up pretty recently. We have customers, obviously, with joint databases, and there's no harm typically in them seeing each other's contracts, but it was more of an annoyance just because one team had a lot more than the other team. So I think one team literally had maybe 10 to 12 contracts and the other had 50. So some breakup like that. And so what we've done here is simply added service department. And by adding service department, this also takes the assignment profile side of team management into account. So if I don't have access to clinical engineering, I won't see any of their contracts. Doesn't hurt anything, but it speeds up my use of the system. Now, before I hand it back, I did forget one piece, so I'm going to open that up right now. I did just quickly want to show you what it looked like when you log in with a different assignment profile. So I'm going to log in here as a different person. And when I come over here to my equipment, I'm a facilities tech. So when I look at my equipment type dropdown, if I click next and previous through here, I'm only going to see things in my assignment profile. That's all I see in my equipment type dropdown because that's all I can work on. So I'm not even necessarily going to see facilities equipment that I'm not qualified to work on. So it's not even just, this is all of my facilities equipment types. These are my facilities equipment types that I'm allowed to work on. So my records are filtered by that and my dropdowns are filtered by that. Makes for a much cleaner user experience. Your techs are really going to love it. But then when you're logged in as an admin, like I was earlier, I can still manage it globally. I can manage both departments if that's my role. So your director level, if they're a director over both, they can still get full visibility over both sides. And then the other thing that we didn't get to was how you set up the assignment profile for an employee. It's very, very difficult. You simply choose the level here and you hit save. That's all it is. So it's easy enough to assign someone an assignment profile. We really try to make it easy where you set it up once and then you assign it out very, very simply, and then it just works from there. So with that, there's about 10 minutes left. I'm going to hand it back for questions.
Thank you so much, Aaron, for all of this valuable information. As a reminder to our audience, if you have a question for Aaron, please use the questions feature on your webinar dashboard. We do have some questions that have already come in, and we will start with those. Our first one, Aaron, is how does a user know if another team member is already looking at a work order?
Really good question. So that obviously would be a concern with teams where if your teams are kind of on it and they're really active about going in there and getting rid of the ones in their queue, it easily could happen where two people are working on it at the same time. Obviously, if they're sitting next to each other, they'll probably just talk. But built into ames, we do have a method of seeing who's looking at a record. I'm actually going to switch back. I was going to leave it at right here, but I'm going to switch back because this is kind of neat how this works. So let me jump to an equipment record here. Go. Oh, right, I'm logged in as different people, so they can't see the same work orders. Hang on. Okay. So as this is trying to come up here, right across the top of the record, it's going to just say that the other person is viewing the record. So it just says, Barry Allen is also viewing this record. So I'm trying to get on a similar record, but I have assignment profiles in my way right now. So see, it's so good, they can't possibly get to the same record. Here we go. So now that they're on the same record, the way that this works, so I have two different employees. I have Bruce here and I have Barry, both looking at this record, and right across the top, it says it's also being viewed by it. And then if either one makes a change, they reassign it to themselves, they do any of those things, any change at all, it not only changes this to a bright red message, it says it's been updated, but if you have a headset on, it will also audibly say it out loud. So the other person is going to know that a change was made, and they can just simply refresh the page and see what that change was. So it's a really neat feature built in that just shows you who else is viewing the record. If there's a bunch of people, it just strings them along. So it's very aware of who's on what record and who's affecting the different records at any given time. So good question. It's a neat little workflow.
Great. Our next question is, if a team member leaves, will they still be assigned to a work order?
Okay, so yes, technically, until you switch the team member out. So if someone were to quit today, I haven't gone into the system and swapped out the team member, just literally that one checkbox in the team setup side. They'll still technically see it, except they don't work there anymore, so they won't see it. And then as soon as you flip that over to the new employee, it'll instantly show up on the new employee's home screen. So they're not assigned because they're not actually assigned, the team is assigned. And as soon as you switch it at the team level, that's why I said it's so easy to manage teams. You set it at the team level and the rest of Ames just works. So as soon as you swap them out in data managers, it's instant. So yes, technically, but not really.
It sounds like most things in life.
I know.
Our next question is, can I use automation to assign teams or individuals under specific circumstances, such as an individual tag or a location?
You can. We do have the area assignment piece as well that I showed. So there's two different ways of doing that. If you use the area assignment piece, that's probably more of like the sledgehammer approach. Anything in that area is going to be assigned to that person. It is filtered by service department and some other things. Automation can actually do the same thing, but you really can specify it down at that point because of that condition section. So you could, instead of saying everything in this building or everything in this cost center, you could say these 8 equipment types in this building get assigned to this person. So automation gives you roughly the same function, but you can really granularly scale it down from there if you choose to. So either works. I think area assignment probably works better for a lot of people, but I've seen some very specific workflows out there as well.
All right, our next question is, can you show again how to do a survey for a particular team rather than a service department?
The surveys are set up for service departments, not teams technically. So let me switch back over here. So out here, there we go, it updated. Out here in customer service, the setup side is actually what you're talking about here, and that is at the service department level, not the team level. However, and again, mostly on the facility side, what I've seen here is they will actually put their trades at this level, which would be more of your team setup. That would be your HVAC, your plumbing. So you don't have to use this at the clinical engineering level. You could, and I've seen this used very successfully, break it down and still use this field instead of trade. And that would give you, I think, roughly what you're looking for there, where you could say biomed, tech level 1, and then a particular form that has a particular survey attached. So technically the surveys are more for the department, not the team. The reporting side is where you could look at the team and say, how is this team doing? But it's the standard set of questions, so it does let you compare. team against team if you choose to do that. So I think it's actually more important to probably have a custom survey so you can compare teams against each other. Not to fire anybody, of course, but just to make sure that everyone's up to standard. So it's more workflow than anything, but it's set up at the service department level here, not team.
All right, next question is, can one employee have multiple trade assignments?
Can one employee have multiple trade assignments? Maybe. Good question. I would assume so. Yeah, actually, yes. Yes is the answer. Because you don't actually assign them directly to the employee, of course. It's done at the profile level. So all of these are multi-select. So you could go into trade. I think I only have one in my demo database here, but you can go in here and choose multiple. And then when you assign this profile to that tech, they would have their multiple trades. So it's up to you, would be the answer. Good question.
Can you assign employees to multiple managers?
I don't think we have that currently. It's been asked for. Wouldn't surprise me if I know who asked that question. It was worded the same way before. But yeah, that will be coming. We do know it does happen. So I think right now you can only assign them to one. If you try to switch them, it asks if you want to switch them or not. So that's an enhancement we're looking at adding, is simply to allow more than one manager. Doesn't really change any functionality. It just means multiple managers would see them on their home screen. So there's a definite advantage there that we see.
All right, our next question is, does AMES.net transfer to AMES 3? And what does that process look like?
Yes, of course it does. So AMES.net is our older software, quite a bit older software. And it's a full transition. So we treat it kind of like a new customer. You don't have all the monotonous meetings because you know the system already, so you don't need that much help making the transition. We offer trainings, of course, that's all included, but it's not like you're a brand new AMES user, so we don't have to teach you terminology and things that we do with brand new customers. So it's a simpler implementation, but it's a full implementation. So we do a conversion. This is a completely different backend, a completely different database. It's a full conversion. The advantage we have is we own both databases. So the conversions are pretty simple now that we have the tool that does it, but it's a full transition of data. And then functionality is usually similar enough that we can get by with some internet training to get you up to speed. So it's I would say, a fairly painless transition on both sides. So yeah, if you want more information on that, certainly swing by the booth if you're going to be at MD Expo, or just send me an email. I am still the implementation manager here, so I know a little bit about it and how that process works. So we can take that offline.
Great, and this will be our last question, but it goes back to, I think, what you were talking about when a change is made and someone is paged or notified of that change. Mm-hmm. The question is, does the system page one person or the whole team? So maybe just the person who made the change or the whole team?
It's whoever is assigned. So if a whole team is assigned, it would page the whole team. Now, obviously, on a new work order, that works well. If a change was made and you were paging it back out, it would still hit the whole team if you didn't update the assignment first. So that would depend on workflow. I would say if you wanted it to go to one person, you should probably reassign it to that person anyways. Otherwise, a new thing that we have here in AMES 3, when you go to, it used to be called page, a work order, you can actually have this instructions box pop up. So you can say, this is for Chris. It'll still go to the whole team, but you can at least put the message in there to direct one person's attention to it. So that's a new feature. If you decide to turn it on, you can put those additional instructions in there and kind of direct it. Otherwise, though, it does page the whole team because it doesn't know why you're paging it.
Perfect. Thank you so much, Aaron, for your time today and for a great presentation. It was very enlightening. We do have some additional questions that have come in, so rest assured if your question was not answered, Aaron will receive those.
Yep.
I would like to encourage everyone in the audience to visit our sponsor today to learn more about the services they provide to our industry. Please visit goames.com. A quick reminder that you can obtain your continuing education certificate by completing the post-webinar survey. This survey will be emailed to you 1 hour after the end of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI. You'll be able to download your certificate immediately once completing the survey. If you have any questions, please contact us at webinar@mdpublishing.com. We'll be back next week with another webinar. Please visit webinarwednesday.live for details and for complimentary registration. Thank you all and have a wonderful afternoon.
Thank you.